We realized we had a problem when we were not all getting the same information with reports. We felt like we needed a standardized form that basically broke down the things that were important to report off on your patients, from the very basics to the more complicated stuff.
We decided we wanted to standardize tools for the different areas. We developed tools, we sent them out to different nurses, different departments to trial them. And we did this over probably a year period, just to try to get people information, get their input on what they wanted for a standardized tool.
So our ultimate goal was then to create the online handoff tool, because that was a joint commissioned requirement that we created that. Our online tool gives us a very nice flow sheet that can explain everything from your patients on their diagnosis, their past medical history, vitals, labs, whatnot. We go through that with our nurse quickly when we're doing our shift-to-shift report in the patient's room, which not only includes then your nurse-to-nurse report, but also includes the patient with their care on knowing what's going on. And then at the very end of that report, there is a part where we can click to validate that we gave report to your next nurse, where we chart that that report was given to that nurse.
So our successes in doing the handoff report has been that we can do it at the bedside, and it involves the patient. The patient can ask us questions, it increases communication, and it also increases patient satisfaction. So by communicating at the bedside using the handoff tool that we created in the computer system, we can go through any abnormal labs, vitals, medications, things like that, and then we can document who we gave report to, and that shows that we do have that communication from shift to shift.
Some of our other successes with building a standardized form and using the online handoff, it has increased the better flow for communication on patient reports. It makes sure that each nurse is giving your very basic information to your patient, and then it also makes sure that you're not missing anything that might be pertinent or important for that patient. With that handoff tool flowing through like your vitals and your labs and stuff, it triggers that nurse to make sure to remind that, oh, this patient had a critical lab result, or oh yeah, this patient has an IV in this side or a drain in this side. It just gives better flow and communication. Other successes is it, of course, includes that patient in their care. The patient then is hearing everything that's going on, can ask questions that they feel like they have regarding their care.
So our next steps are to continue to reevaluate the tool and then do some audits to make sure that the tool is being used for bedside shift reporting.